we're saying baby, baby, because we're talking about how pregnancy and birth can impact infant development. And so, baby, we're trying to help you out. We're trying to give you information about how pregnancy and labor and birth can impact infant development. I love our song. Just now, we've only done this twice. This is so fun. Again, that was the Supremes. We love the Supremes. I love starting our show with music. And setting the mood and the tone to talk about birth. This is going to be chiropractic care. This is prenatal. This is pediatric exam questions that I will ask in the office. And why am I asking about prenatal health history and birth at the pediatric chiropractic exam? Like I guess that's the bulk of what we wanted to talk a little bit today about. So certain questions that I'm asking, why am I asking it? And then the big point again is that why am I asking what type of birth presentation, interventions, all of those things, and prenatal history. So I think that's what we're going to talk about today, Rachel.
Keep the music coming, Dr. Shannon. Oh my gosh.
About. It was
I love it. I love the
Justin
energy.
Bieber, but we went with the Supreme. Welcome to the Aligned Birth Podcast. I'm Dr. Shannon, a prenatal chiropractor.
And I'm Rachael, a birth doula and childbirth educator. Together, we're here to bring you conversations about pregnancy, birth, and motherhood. From cesarean to VBAC, hospital to home births, we've experienced it all. We are high school friends who reconnected through our shared passion for health and birth. As moms to 2 young boys, we've both changed careers after our own transformative childbirth experiences.
Join us as we discuss the importance of a healthy body and mind throughout pregnancy, birth, and into motherhood. Our goal is to provide fun, interesting, and helpful conversations and interviews that inspire learning. When your body, mind, and intuition are aligned, you can conquer anything.
Sit back and relax, or grab a notebook and take some notes, or maybe listen as you enjoy a walk. However you choose to listen, we hope you enjoy this episode of the Aligned Birth Podcast. Before we get into the episode today, if you enjoy the content of this podcast, we would greatly appreciate your support in one of 3 ways. First, leave us a review or give us a 5-star rating. Your feedback helps us reach more listeners and make a bigger impact. Second, you can sign up for our newsletter. By doing so, you'll be the first to receive new episodes and exclusive bonus resources straight to your inbox each week. Lastly, you can become a direct listener supporter. Running this podcast requires significant time, effort, and resources. Your contribution, no matter the amount, helps us continue providing valuable content to a wider audience. Simply use the links in the show notes to make your donation, sign up for our newsletter, or leave us a review. Every contribution matters and is sincerely appreciated. If the Aligned Birth Podcast is a part of your weekly routine and you love what we are doing, please consider supporting us through one of these 3 options. Your support will create a ripple effect, allowing us to reach more listeners and make a lasting difference.
Bieber, but we went with the Supremes.
All right, next time maybe we'll do Bieber. But I love a little bit of music, gets the energy going. Definitely a great conversation today that I'm looking forward to because I think this is really helpful for expecting moms or new moms to think about how the way their baby is born and what they experience during their pregnancy and then how baby is born impacts the health of baby, including feeding, sleeping, digestion, like all the things. And you've taught me so much, and that's what we're kind of going to do today is help you kind of highlight what you do with your patients to sort of extract the information needed to help better take care of mom and baby in a way that no other practitioner is doing. And I think that's really important to know of, like, you are looking at like the whole picture, gathering information, and then providing care that meets the need based on what they go through. And so
we're connecting dots, like connecting dots that you may not realize that the dots are connected between birth presentation and constipation, labor and birth and colic, labor and birth and nursing issues.
Yep.
Just connecting
And
dots.
it's so layered. It's not straightforward. I feel like we are wired and raised to like see a problem and be like, or see an actual like probably nervous system response in a baby or a behavior and want to like fix it and think something's wrong from the outside versus like assessing what happened before and what's going on inside. And that's what I think you do so beautifully. And I think something else I've learned from you that's so helpful for people to know is that the birth doesn't have to be quote unquote traumatic to impact baby. Like they are still going through a major event coming through the pelvis and out into the world, or coming through your belly via cesarean. Like it is, and then how they were inside the womb, like all of that impacts how they kind of regulate into the world. And so you're going to help us kind of understand that better so that maybe new moms can achieve care that's actually helping their babies feel so much better and thrive during this time versus suffering and wondering, going to the pediatrician and then just who knows.
Or it's just, a medication, or, oh, they'll grow out of it, or this, all those little things that I hear. And I'm like, it doesn't have to be like that. Or we'll just wait and see. And, all those types of things.
Pediatricians are prescribing like Pepcid for newborns.
Yes. Yeah.
And I'm not like anti-Pepcid, but I'm also like, could that pediatrician and could that mom explore other options to see first? And then if not, maybe try Pepcid. But that's just like, it's the Band-Aid. That's not actually kind of getting to the root, but it might help it for a season, but I still encourage trying to get to the root.
There's some other things we can do. I usually don't talk. Some births are, yes, traumatic, but most of the time I like to say that birth is a stressful and strainful process, because it doesn't have to be traumatic, but there's a lot of stress and strain that happens to mom and happens to baby as well too. I think we understand for mom what that's like as far as just the pain, the labor, we remember it, but as babies don't remember,
right,
consciously remember birth, so it's not like they're communicating in the best way that they can. So I'd like to say that it's stressful, strainful, process. But if your birth was traumatic, it doesn't mean that you and baby have to stay in that trauma response as well. So there's things that we can do for nervous system regulation as it pertains to
so
that.
I know when someone comes to see you after their baby's born, you ask them to tell you about their birth and maybe their prenatal history when they're coming in for that pediatric chiropractic care. So can you tell me a little bit about that the information that you're looking for and kind of why it matters?
So this is why I love seeing moms while they're pregnant, and then they come in for their prenatal or come in for their postpartum re-exam. And then we do the newborn exam at the same time then, because I get to hear the birth story and history. I knew them prenatally and knew what we worked through. I knew what was going on. And then it's just that other layer of insight into, okay, and now how is baby presenting and what is going on here? Baby doesn't have to have a problem. There doesn't have to be an issue for baby to be checked as well. But so there's two couple different types of parents that come into the office. So those that have been under care, during their pregnancy, and then they're coming in because they want newborn to experience all the goodness as well. And other ones that had labor, birth, and then they maybe have some sort of issue going on now and referred, or for whatever reason are coming in for care. I know that sometimes I have that are just coming in for wellness care because they just want to make sure that things are right, but no matter what, I'm asking about the in utero history. So how baby was in utero, if they were breech, if they were transverse, at any point in the pregnancy. That does give insight into things that I look for. I'm going to be checking hips, I'm checking pelvis alignment, I'm already checking that. But there's another layer that a different lens that I will look at it with. And that's going to be the same thing with the pediatrician as well, too. They're going to do all of these orthopedic hip tests to make sure things are fine. There's a lot of different breech presentations as well, too. So it's going into the specifics of how baby was in utero, because that can give insight into biomechanical things that are going on in the infant now. I always want to know like how labor started. That big aspect of, and I always ask about interventions too, so this kind of goes into that, but did you go into labor on your own, or did we have to artificially get it started? You know, when I ask that and I'm thinking about it, I guess I'm going to, was everybody ready for baby, or were we still not ready? And I'm looking at that from like nervous system standpoint. I had one mom and she had a 7-year-old and she's, waiting on baby to come. And he's like, Mom, you just got to let go. Just let go of the baby. And I was like, oh, that's so easy. You're 7. He's like, just let go of the baby. Why is the baby not coming out? Just let it go. But in my head, I was like, whoa, that is so deep. He does not understand how deep he's going with that, because I'm looking at that from a mental aspect as well, too. How mom was, were we holding on to a lot of fear, a lot of stress, and that dance and that play with baby as well, too. So I do want to know how labor started. Birth presentation, so how baby was engaged in the pelvis. There's lots of different things. Well, I mean, if it's breech, if you found a provider that supported a breech birth, like all of those things. But with the positioning, it's also too where we occiput posterior, occiput anterior, shoulder dystocia, like all different things with the little hand coming out first. Like there's lots of different things to make note of in that birth presentation. Pushing positions, I do like to know how mom gave birth, like how was baby actually born? Were you on your back? And some of this stuff, it's just, I don't know, it's intriguing to me too, to know, okay, this is how it worked out for this mom for whatever reason. I guess I'm usually asking that birth presentation or birth position if I had mom prenatally, because I want to know what were we able to achieve with care and how easily were you able to move and manage those things, but it gives me a little insight too. And then granted how baby was born. So this is either vaginal, it's either cesarean, it's interventions can be a wide range of interventions, as in like starting labor, internal fetal monitoring, the stress levels there, and interventions as if there were forceps or vacuum needed as well too. So I ask about all of those things. And I want to go into like why.
Do you know the pediatrician only asks, the pediatrician only really cares about breech. Like the pediatrician doesn't ask all those other things. They do not. And breech, because we know the connection to hip dysplasia.
The hips. And that's really why. But see, when I'm looking at this, I'm like,
there's the nervous system.
Mom supported during all of this?
Yeah.
Because if I know, well, we had, if baby was in distress or all those other little things, then I know, golly, this was probably stressful, So it didn't have to be traumatic. Like sometimes I think I just don't like that word. It doesn't have to be traumatic, but like it was stressful. And that stressful aspect, I look at that now is how is this newborn now handling this new world outside of the womb? I also like to know too, because I want to hear mom and I want to know, does mom need support? So even I have a lot of moms that will come in. They did not see me during prenatal care. They've had nursing issues. Their lactation consultant sent them to me. I'm working with them and I talk a lot with mom, and I'm finding out mom has a lot of postpartum mental health issues. I see that.
Because you start kind of peeling back the layers. Like as you're when I'm adjusting baby,
I'm talking to mom as well too. And I'm checking in and how are things. And what's really cool is when we can get baby out of that stress zone, I see mom get out of stress zone. So even if mom isn't under care, I think it works better when I have both of that unit under care together, because they feed off each other, pun intended. So at least one of them's feeding off the other, but there's that connection there as well
Mm-hmm.
too. So I guess that's what I want to get at with talking about this, is that it's so much bigger than like, I'm no longer nursing with pain, you know, or those type of things with pediatric care. There's that bigger nervous system regulation aspect to it as well too.
Absolutely. And I think
that's a
too, like if
sidebar.
the
I don't know
birth
where I'm
can
going.
go as smooth as possible and you could have achieved everything you hope to achieve, but yet still have some nervous system dysregulation, that you can help identify and assess by asking these questions and kind of peeling back the layers for both mom and baby. And I think that's huge. So definitely if there was some known trauma or stress at birth, but even to me, regardless, I think it's good because you can have things go well and still have that dysregulation and you don't really know it. It's not something we can pinpoint. And again, culturally, society, like we like to be able to very like know exactly, like have this one thing that we can fix or this one identifiable problem. And most traditional medical care providers, I'm thankful for them, but don't always look at the whole. And I think that's what you're doing here. And that's so incredibly valuable to new moms, and that ability to be able to even have that spidey sense go off of like, okay, I think they might need additional support here, and be able to refer out is so beneficial for a new mom and a new baby.
Yeah. Cause I see them and I hear them, whether they, you know, come in for care or not. I was going to say something because you had such good things that you had said there. It'll come back to me, I suppose.
So tell me like about the, like once baby's here, some of the things you might ask about how things are going now that baby's here, like nursing, sleeping, bowel movements. So like current
there
stuff.
are like main ones that I always ask. I want to know nursing. I want to know, is there
what do you want to know
nipple
about nursing?
pain? I want to know. Yeah. So is there nipple pain? Do they nurse well on both sides? Are they only taking a bottle? Are they super sleepy with nursing? Are they arching and they are pissed off? I had one family, they called it, he just sharks. He's just sharking all the time. Well, at least nursing. Sharking. Like I loved it. Like all of that with nursing. Are there bubbles? Do you hear clicking? Is there, are they dribbling a lot with it? A lot of times too, I can observe nursing in the office, which is really awesome. I am not a lactation consultant. I love working with lactation consultants because I have certain things I'm looking for. And I had Jana on an episode, I don't know which one we did, but Jana Birdseye. And I work so closely with her, and it is amazing. We've worked on infants together before. It's so good. But there are things I'm looking for. And I mean, there's a lot of nuances with nursing. What positions they like, what positions they don't like. And
I know it's so crazy how often I hear, and it's assumed as normal, of like baby likes this side but not this side. And I'm like, that's a telltale sign that they probably have some tension on one side. And chiropractic care can definitely help with that.
Exactly. I think that's like the bulk of nursing. A lot of times moms will be like, if I'm not asking a specific question, it will come out in the answer of another question. I mean, my job is so much in the questions that I ask. And when I just shut up and listen and hear what they're saying, that is like, that gives me
truly
so many clues.
Listening versus just trying to gather information.
Because I'm like, okay, this is giving me clues into other things. Sleep, or even too, like if they take a pass or if they don't, what happens there? Is there reflux? Do they burp? Do they not? Like what ticks them off? You know, like when are they getting us up outside of, well, they're hungry and they have a wet diaper? Like there's certain things where, yeah, I expect them to be upset because this is how they're communicating, but is it outside, you know, the ranges of normal there? Sleep, I don't expect newborns to sleep for great lengths of time. You know, I expect there to be lots of nursing. So it's not more, it's just an aspect of where are they at in that sleep schedule? Are they within those degrees of normal? Are they sleeping too long, sleeping too less, you know, because that gives me insight into how their nervous system is functioning though too. tummy time, I know we're talking like there's different levels of this from newborn
Mm-hmm.
into not newborn care. But spending time on belly while they're laying on mom, like that's what I usually say first. But I want to know, do they do that well? Do they rest both
Mm-hmm.
cheeks? A lot of parents think tummy time has to be they're on their belly and they're lifting up and they're engaged the whole time. That doesn't have to be. At the very beginning,
Mm-hmm.
I actually want them to just rest a bit. I don't want them to turn their head to both sides,
Mm-hmm.
because I want them to rest both cheeks evenly. Bowel movements, there's a lot of times when they're like, well, the pediatrician says, it's normal for breastfed babies to not have bowel movements for several days. And I hem and haw on that as far as how I really feel, because if I don't have a bowel movement for a few days, I don't know how that feels, because I don't go that way, because that sounds miserable.
Yeah.
But there are degrees, like every infant is so different though. I just want to know, okay, where are we at? How are they, what's their, everybody's different as far as like maybe what's their normal, but I want to know,
How things are moving.
it's coming in and it's got to come out. How about our poop and our pee diapers?
And
So
consistency. Like formula
mhm,
babies can have like more firm,
very
harder
different.
poop. So it feels like it'd be easier to get constipated on formula. But again, it's
Hmm.
not to not formula, but if you know that and you kind of can
Hmm.
identify that, we can talk about other
Yeah.
things.
How
And
they're
then
eating. Hmm.
breastfed babies can tend to, it's a lot softer. So I always feel like they kind of poop more, but they
Hmm.
also digest more of the breast milk. Like it's more like used in their body, absorbed and more functional. So
Hmm.
they like it's kind of like less poop, but it's like more often. I don't know if that makes sense.
Hmm. So that's kind of, that just jumps out to me off the top of my head when we were coming up with the outline, as far as like, these are things that I'm really asking on. Now, I don't, if there's an issue and parents are coming with an issue, then they're talking about they're very fussy, they're very gassy, those type of things. Then yeah, I go through a little bit more in that. Are they always gassy?
Mm-hmm.
What seems to work? Does
Right.
anything help? Does it not help? So, I mean, there's more to it, but these basic ones I am asking every, pediatric exam, whether they come in with whatever their issue is. Does that make sense?
Mm-hmm.
So if
Well,
they're
yeah, you
coming
want to
in
look
with
at the whole thing.
constipation
Again,
issues,
usually what they
it's
think is
sleep
the
and tummy
issue is
time.
not the issue.
Mm-hmm. Mm-hmm.
Like and
Because I'll
or
see a
you learn
lot.
more about
Connecting the dots. Mm-hmm.
mm-hmm.
Connecting the
Yeah, so
dots.
you gotta look at the whole thing, because I could say I mean, you could say they have gas, but then learning more about their feeding and how
Mm-hmm.
they're feeding and how they're latching can correlate, and we can learn if that gas is within the normal range because it is normal for newborns to have gas, or is the way they're nursing or feeding impacting that. And
Exactly.
so that's, you kind of bring it all together by asking about feeding or asking about sleep or whatever. So I get it. And I think it's so
Mm-hmm.
helpful. And for a new mom to hear that this is looking at the whole picture. This is what
Mm-hmm.
that is. And again, we're
Mm-hmm.
just trying to help paint that whole picture why this is so beneficial.
Mm-hmm. Exactly. Nope. Um, so that's kind of those, I guess, the go-tos, the questions
The history you're
that I'm
gathering.
looking at. Yeah.
Mm-hmm.
Of course there's the exam aspect of things, but I want to go into, I want to touch a little bit on some of the nerve parts of the nervous system function, and then also when I'm looking at like structurally
Mm-hmm.
in the spine. So,
Like how
I don't
you're
know how,
physically assessing.
yeah, how you're, yeah, well, that, but like, why am I asking about head rotation with nursing, and do they nurse well on both sides? And why is
Okay.
that cluing me in to where in the spine do I need to look? And why I'm
Mm-hmm.
asking about how birth
Mm-hmm.
impacted that. Does that make sense?
Mm-hmm.
I don't know how I want
Yeah.
to like get there with this, because we have our outline, but I'm also like, I don't know how I want to like connect everything. It'll work out. Um, I want to go into, okay, here's what I want to start with. I want to start with the cervical spine, and you've got 7 vertebrae in your spine, in your cervical spine. And the top 3, well, occiput, So, C0, I guess, or whatnot, but base of the skull. And then you have atlas and axis. So C1, C2. And those are where all of your flexion extension is occiput atlas. So base of the skull and that top bone of the neck, flexion extension. So tucking the chin and looking all the way up at the ceiling. That's where that occurs. And then the atlas axis is rotation. So that's everything turning left and right. That is where all of that motion occurs in the spine. The rest of the cervical spine is essentially for support. And fun fact with tummy time is how the baby develops their cervical curve in their spine. Because when they're born, they're in that little C shape. And so tummy time, that's that first introduction of really forming that cervical curve, which impacts them for the rest of their life. Anyways, that's where, so now that we know that flexion extension and rotation occurs on that very, very upper neck area, if we have a baby that is born and their chin is tucked a little bit, and so now we've got a misalignment in that occipital atlantal joint, then that presents a set of problems, as far as now we might have nursing issues because we don't have a lot of good flexion extension. Now we're arching really bad. Like the baby tries to fix things. I've heard of babies where they will headbutt because they are literally trying to fix a subluxation that is happening in their body. And that's the only way that they know how to do it, or they're screaming and crying because it's not working. So also too, if they come out and we've got chin up a little bit in the air, we've got an AS, what we call anterior superior occiput. So we have these different levels and degrees that the bones are moving. That presents a whole other set of issues. That's our stargazer baby as they're looking up. And then you got to think about, okay, so now if they're stuck in this flexion, they're stuck in this extension position, what is that doing globally to the rest of their spine? Because everything is connected. The sacrum is connected to the cranial bones. So that's pulling and tugging on everything. So that's where I want to get at with how that birth, why I'm asking about those type of things, or wanting to know, well, this is how I birthed, or they were stuck in the canal for this a little bit. Like, okay, how is that impacting that bony, that skeletal development? So that's one thing. When I'm going into nursing and they're not nursing well on one side versus the other, that has a lot to do with atlas axis, because that's rotation. And atlas and axis can typically, in our infants, it's just going laterally. But as we get older and the bone actually forms this little curve and it kind of looks like this little shelf, now it can come laterally and it can come superior, inferior as well too. So this is more of my adults, but just to give people a clue, like it can subluxate in all these different areas. And that's at C1. That's that top bone in the neck. That's where the nerve supply is going to head, neck, shoulders, eyes, ears, nose, throat. That's headaches, mood, fatigue, balance, anxiety. That's all of these things that are connected to that top bone in the neck. So when I'm looking at that with infants, obviously I'm not looking at infants with anxiety. I'm not talking about that. But sorry, I digress with that. But that's where I'm looking with that rotation. So if baby is not wanting to turn their head and nurse at one side, that gives me a clue into atlas and axis and how they are aligned. And then if we're not turning and we're not doing flexion extension properly, then we can potentially have hiccups in how baby rolls, in how baby engages in tummy time. Are they using left and right arm equally? Are we going to get a flat spot on the head because they're not moving in all directions? And then it kind of snowballs from there. I'm not trying to freak people out in a bad way, but it's more of, that's where I go back to the beginning with that, is it's how the child is then going to develop from that point on, because that beginning stages impacts everything else as well. Because then it's like, we're looking at rolling, we're looking at sitting, we're looking at crawling and crawling patterns, and then we're looking at walking. Like it is all connected there. So just tiny little insight into those top bones in the neck, those top bones in the neck. You said
tiny little insight, and my mind is over here exploding.
Well, I feel like I'm not doing it service because there's so much to it, but And I don't know that I'm explaining it.
You are doing it
well.
service. Oh
know.
my gosh.
But there's a lot.
Well, if anything, it's just sort of like, it just is like, there's so much connected. There's so much happening, and we don't see it. We're not trained to see it as the everyday person. And so I just love it. Just shows how much you know, and it shows how much there is to know, and so much to evaluate with how
and how much we
newborns
can do with care, with very simple adjustments. I mean, I didn't even go, there's dentate ligaments that attach to all parts of the spine. And it's how this tensegrity happens in the spine, how everything is connected. And so a pull here causes a push here, causes a pull here. And that's why if we're not nursing well, I want to know about constipation issues, because a lot of times that's connected there. You know, that spinal cord is tethered there, the base of the spine, and it's the same covering that goes up into the brain and covers the brain. So it's all connected there. Yeah. So that's the one. That's what I wanted to really hit home with that birthing position, and why all of that matters, and what that implication as far as the skeletal structure. Now the adjustments, I guess we didn't even put in here, like, what do the adjustments look like? It's very simple. It's not snapping, cracking, popping, whatever you want to call it. It's very small, gentle touch that can restore that motion. And it's not always a one-time fix. It really depends on the degree and level of the issue that we have there. But I had a mom in recently. She's got two older girls, but we were doing their exams. So what are we, like 9 and 7? And I do nervous system scans, and the temperature scan I have really assesses like autonomic nervous system function. We're going to talk about that in a minute. And that's really looking at like that parasympathetic, sympathetic balance. I look at like blood vessel gland, organ function, gives me some insight into how the nervous system is functioning, how their body is handling stress and those type of things. So we did both of their scans, and different pregnancies for mom, both cesarean births, and the girls but they have very different, not issues, but very different things going on. Some sensory issues over here, some behavioral issues over here, but they both had bigger temperature difference readings, which shows me that there's some nervous system irritation at that top bone in the neck. And what I looked at her and said, and I was like, they can have very similar subluxations. So that nervous system impact in the aspect of like, it happened in the same area of the spine, but it is manifesting completely different in these children because we're all so unique. It's biochemical individuality.
Right.
And that's where I want to go with a little bit of that care, because it's not a one size fits all care plan. So everybody that comes in with nursing issues, it's not the same thing every time. Everybody that has constipation, it's not the same thing every time. There's not the same reason why. So that's why, yeah, it's well and good if you want to use Miralax and crap like that, but that's why it's not going to work for everybody. And if you can get to that root cause a little bit more,
you can actually resolve the issue as a whole.
Resolve it as a whole. Yeah.
Versus just putting a Band-Aid on it and maybe it goes away, but it'll come back if you don't treat the root of it. So I think understanding, and that it's like it's an ever-changing thing, right? Like, and I think when you do it, the sooner you do it in a little one's life, I think the better the foundation is laid. But it's just sort of like an ebb and a flow. And based on what they go through in their life, we kind of keep coming back to chiropractic care for that kind of re-regulating of everything. At least that's how we treat it with our family, because my boys have seen chiropractors since they were born. And it's this, we just kind of always like are with the flow and use it as this well care and checking in with all the things you're saying as they've grown
to help them adapt to those stressors,
how they're adapting and how their, nervous systems are regulating or not in their current environment and with what they're facing. And I just think laying that foundation is so important, and just understanding the benefits overall. I think it's so beautiful, and I love that you do it.
It's neat.
And I love how much you know. It's mind blowing.
Well, thanks. No, there's so much more. All I can think of is other instructors that should be talking about this, that are like within the International Chiropractic Pediatric Association.
I
keep thinking like, they would explain this so much better. So I know I'm missing things. But I do me. This is it. This is what you
Girl,
get.
you're
And I got
doing
the podcast and they don't. So
amazing. You're sharing the knowledge, you're sharing your wisdom, you're compassionate. Like,
love it. Love it.
yes, there are other people out there doing it. They don't do it like you do it. Don't go down that road.
No, I'm like, oh, did I say this? Did
The
I not
more
say
you
this?
share, the more it helps people.
Yeah.
And slowly but surely people get, awakened to
They
this
hear it how they need to
type
hear
of
it.
care. Yeah. And everyone comes
Mhm.
to it in different ways. And I'm a huge
Mhm.
proponent of it. It has helped me tremendously from pregnancy to postpartum to my kids. I mean, I can't say enough about just the
Mhm.
holistic nature of it. And everything you're saying is like, you're not getting that kind of care
pretty
from
cool.
any other practitioner.
Yeah, that's true. That's true. So I will say that. Another thing with infant or newborn exams, and why I'm asking some of those physical things with birth, like with a cesarean birth, there's primitive reflexes. So when a baby is born, there are certain reflexes that they are born with. These are kind of like primitive brainstem things. You don't have to think about it. There's rooting reflex. So you stroke from cheek to ear. The baby will turn, open their mouth. That helps with feeding. There's palmar reflex. There's gallant. This is my favorite one. You stroke from the shoulder on one side down to that hip, that top iliac crest on each side. And the baby should kind of like turn towards that side. You do the same thing. They turn toward the other side. That reflex is when they are in utero and when we're in labor and birth and the uterus is contracting and it's contracting and the baby feels it on one side and they shimmy, they move, they shimmy out of the birth canal. They actually like help themselves be born. It's that beautiful dance with mom and baby. So all of these reflexes are there for a reason, survival aspects when baby is born. But as baby develops, and as we get older and frontal lobe develops, yes, this takes a while, but those reflexes are turned off. We no longer need to be stimulated for rooting reflex. We no longer need these things anymore. They need to be turned off in a certain order at a certain time. And that's where those developmental milestones come in, as far as, is baby rolling? Is baby doing tummy time? Is then baby like moving from laying on belly, rolling to both sides, rolling belly to back to belly? Are they sitting? All of those things happening in that order and that timeline. That's what those developmental milestones are. And that's where some of those reflexes come into play. Sometimes they don't get turned off at the right time in the right order. And with newborn and infants, I'm seeing, are they there? And if they're present, that's good. If they're not, that's not, like I'm looking at both aspects because we want them to be there, but then they go away and they all go away at different times, different reasons as the baby develops. It's really, really cool. My older kids, I'm looking at, are they still there? We have a whole other episode on that. I won't get into it.
Well, yeah, like the Maro reflex I've heard about, like that is one that should be turned off. And then if by a certain age it isn't, then that's a sign of that nervous system dysregulation and that they need a certain type of therapy.
Yes. Yeah. So we can do adjustments, and then there's exercises to help extinguish those reflexes. Because what happens then too is our body is using so much extra energy to process this Maro reflex that we don't want. We don't need to be startled every time a door closes. It's so much extra energy that the body is using, and it's dysregulating.
Keep you in that a better state overall.
Exactly. Yeah. So with my older kids, that's what we're looking at. But my young ones, I want to know, do we have a rooting reflex? Do we not? So we're checking those. But with cesarean birth, they don't get to experience gallant at all. So it's very interesting when they're born, they don't experience. They also don't get the good cranial molding and the squish coming out of the birth canal. They don't get that bacterial bath. I'm not bad mouthing cesarean birth at all. I'm just letting you know, because I have a cesarean kiddo and I deal with it. But now we know. So there's things that we know that happen in a normal physiological birth, and then this did not happen in the cesarean birth. What can I do to set my kid up for success? Because there's things you can do. You're not helpless. So there's things you can do.
Right.
But that's
it's all just about what you know.
A long birth that presents different. I want to ask and know, okay, how long was their pushing stage, and then how long was their labor? Like that's what I want to know. When I'm talking to mom about baby, that gives me ideas into cranial molding, because we should have an overlap of those cranial bones. And then as baby comes out and starts to nurse and form the palate, which changes the shape of the skull, that's when we get some of that cranial molding. That's why that nursing is so important, to know, okay, are we molding correctly? And rapid birth as well. presents just different issues. I'm looking at that cranial molding again and their nervous system response. Are they super stressed when they came out, or are they low tone, super docile, sleepy? Like there's two different things there that you can get. Asynclitic position, that kind of we talked about with the flexion, extension, any sort of weird rotation, clavicle, all of those things.
That's where we might see the torticollis. If they were maybe in that acyclic position for an extended amount of time, which is the tilt.
So we've got a head tilt and a rotation. So head tilt, they can just have head tilted to one side. I see it a lot of times in a car seat. I do not like when baby always turns to one side in a car seat. I want them to kind of be able to turn to both sides. When you have a head tilt and a rotation, that's the full-blown torticollis. So that involves a little bit more of the SCM muscle. That involves a little bit, that's different. And so when I'm looking at things, I'm like, do we have a head tilt or do we have full-blown torticollis? Sometimes we have the torticollis. That's when I'm going to see a little bit more. The head shape is different. I can see some plagiocephaly start to form as well, which all of that impacts that the brain is going to grow to how the skull is. And so we want that to be growing and molding properly. Instrument deliveries as well too. That's a whole other issue, because I want to know, not again too with the stress aspects and that nervous system response, but cranial molding things as well too, because again, that brain is going to grow and form to that shape of the skull. And then the feeding challenges. I wanted to reiterate the aspect of why nursing is so important, or breastfeeding in general. Well, not breastfeeding, like feeding in general. Like you don't have to nurse. You don't have to breastfeed. Like you can do, bottle feeding as well. That's totally fine. But knowing that how baby nurses can impact I want to look at the shape of the palate, and I want to know that tongue function, like all of those things that play part in how the bones in the skull are going to eventually form and mold. So that's why I ask all those questions.
Just a little bit.
That's why
just a little bit.
All those questions.
No, it's beautiful.
Get into the sympathetic, parasympathetic mode. Well, I will say this: sometimes you have babies that are born in that stress. So if mom was kind of in fight or flight, then sometimes baby can be in fight or flight, and it can be very, very stressful for them. So you've got your central nervous system, peripheral nervous system. Central is the brain and the spinal cord. Peripheral is everything else outside of that. And within that peripheral, you have somatic and you have autonomic. And somatic is like the muscles. So that's the brain telling the muscles to move and the muscles saying, hey, this is what's going on. And then your autonomic is then put into that. That's where you hear sympathetic, parasympathetic, and then you got your enteric nervous system. It's like it's really cool. It's its whole thing.
Yeah.
But that is, when we're doing adjustments, we can really impact that autonomic. So not only the skeletal aspect. So I'm talking about, yes, how are the muscles tight? Is this bone out of place? Yes. Okay, let's do that adjustment. Help those muscles, help the head turn, help the head shape, but also it's going to impact the other parts of the nervous system as well too. So then we can have better response from the brain to the body to inform the brain better about what's going on with the stressors, that smooth muscle, cardiac muscle, glands, blood vessels, glands, organs, that aspect of things too. So I did want to touch on that.
Yeah. It's more than just the skeletal. Right? It's helping everything. And that's what I think a lot of people think is just bones and cracking and stuff. And it's like, obviously you have exemplified here how it's all connected, how it's all different. And even if like two people had similar births, like how their baby responds or how they respond could still be different based on other factors. So I think this has been tremendously helpful. You've laid out like based on the type of birth you had, just having that knowledge of like, okay, this is important for me to just assess and review with the right provider, such as yourself, all of this stuff to try and figure out the best course of care for a mom and, or, a family and their baby. So thank you for sharing everything you have shared here. We also have a few other episodes that highlight some of these topics. We have episode 95, how the birthing process impacts infant feeding. So you're going to hear a more in-depth conversation about that in episode 95. And then episode 69, benefits of pediatric chiropractic care. And then episode 57 was the one with Dr. Rosen. And he talks about mode of delivery and that nervous system response and all of that, and how that impacts the pediatric kind of care plan with chiropractic adjustment. So that's a wonderful episode. I've listened to that a couple times and shared it with many people. So all really helpful episodes for continuing to learn about the importance of
all the
pediatric chiropractic care.
I want to mention that this isn't based on a Pathways article. So Pathways to Family Wellness, it's that International Chiropractic Pediatric Association magazine that's put out. But there is an article that talks about relaying the groundwork, 5 reasons why your birth can affect your baby and your parenting. And so I think it's worth mentioning. That's like another article to read that goes, it just does this a little bit differently. But again, that's some more information. All the information.
That's what we're here for, offering information, sharing knowledge, sharing resources, and hopefully we've left, you with a little nugget of wisdom that you can take with you to, have a healthier, more satisfying birth and postpartum journey. Go see your chiropractor, especially Dr. Shannon, if you live in the area.
That's right. If you gathered anything from the show, just go see your chiropractor.
That's it.
All right.
And make sure they're as thorough as Dr. Shannon.
There you go. Thanks, friends. Tune in next week for another episode. Thank you for joining us on the Aligned Birth Podcast. We hope you found our discussions informative, inspiring, and enjoyable. Remember, when your body, mind, and intuition are aligned, you have the power to overcome any challenge that comes your way. We appreciate your support and leaving a review or rating, signing up for our newsletter, or becoming a direct listener supporter. Your contribution helps us continue delivering valuable content and reaching more listeners like yourself. Stay connected with us through our newsletter to receive the latest episodes and bonuses straight to your inbox each week. You can also connect with us on Instagram at aligned_birth. All links can be found in the show notes. Together, we can make a difference in the lives of the birthing individuals and new moms. Thank you for being a part of our community. We look forward to sharing more empowering conversations on the Aligned Birth Podcast. Until next time.